I'm Carly Jensen. I'm one of the physicians here at the Uxbridge Health Clinic, and I also work over at the hospital and the chief there. And we know this is a time that people are really worried, so we wanted to provide a friendly face with some answers that you have for us in the community. So I've got a list here of a bunch of questions that were sent into our website, and I'm going to do my best to answer them. So the first one here, it's someone who's currently pregnant and they're wondering if they're at any greater risk, and in particular their husband also works in a healthcare facility, so they wonder if this puts them at increased risk. So actually the good news is for people who are pregnant, there doesn't appear to be any greater mortality in your group. So that's unlike the influenza where we know that that's a bit of a higher risk. In this scenario, everything seems to play out very similar in the pregnant person as the non-pregnant person. Other good news, you can still deliver naturally. It's just everyone's going to be gowned up in all sorts of paraphernalia, so you don't need to be worried if you see that happen. That will be their process. And then for women who are breastfeeding, if you have symptoms or you yourself are concerned that you might have COVID, it's still safe to breastfeed. If you have a fever, chills, or cough, or symptoms of COVID, then just wear a mask when you're holding your baby. But the baby, as they're nursing, are getting your antibodies as well, so we are still recommending breastfeeding in that scenario. So that was the first question. And then actually there's a couple of other questions here that are also related to self-isolation and what to do in very specific scenarios. So I've got a grandmother who's wondering if she should be babysitting her grandchildren. Maybe it depends on how cute they are. And also a family member who's wondering if they have to self-isolate when their family member is self-isolating. And then what do I do if I live with an immunocompromised person? So for grandma. So if these grandchildren have been self-isolating themselves, so let's say they haven't come back from a March break or they are living out in the country and they haven't been around a lot of people very much, chances are they are not carrying this disease. And in that scenario, you could help out your son or daughter by babysitting the grandchildren so that they can still work. If, however, these children have been out and about and mingling with lots of other people, it is possible that they're carrying it. And I would suspect that you probably fit in the gray hair, white hair, no hair category, which means that you're higher risk for COVID. So I would avoid that if these grandchildren have been out visiting with other children. So I mentioned the older population, and by older we're actually now defining it as over 60 as opposed to over 80, which a lot of people are thinking. Over 60 appears to be sort of the tipping point where some of the risk occurs. So I just want to make that clear. So over 60 is one of our special groups, or groups that we worry about. We also do worry about people who are immunosuppressed. So let's take people with autoimmune disease, rheumatoid arthritis, Crohn's disease, celiac, things like that. Yes. No offense, but your immune system sucks a little. So it's also going to suck at being able to fight off COVID. So yes, you are a higher risk. Some people are wondering, well, then should I stop my immunosuppressant drugs? No, not a good idea. We don't want you to suppress, not, take these medications as prescribed, because then your underlying disease can compromise things even worse. So definitely don't take that into your own hands. If you have a specific question about your medications, call your doctor to get advice. So for example, if your disease has been stable for a long time and you want to know if you can come off your immunosuppressants for a short period of time, worth the conversation, but don't do it without the advice of your doctor. The other question is, what do I do if I live with someone who's immunocompromised? Well, you might want to set up a system in your house so that you minimize the amount of interactions that you have. So this is really self-isolation, where you're purposely putting distance between yourself and other people in your house to try and minimize the risk. I'll try and explain this in a way that hopefully is transparent to any situation. So anytime we interact with other people, we are shedding little bits of viruses and molecules that fall out of my mouth while I'm talking. Thankfully, over the internet, you are protected from me and my little spittle droplets. In fact, spittle splatter zone, I want to sort of trademark that as my term to describe what happens with COVID. But as I'm talking here, little bits are going out. So you can think of that like lottery tickets to catching the disease. So the closer you are to someone, the more lottery tickets you're going to accumulate. The more you're touching surfaces around you that person have talked on, the more likely you are to come into contact with that. The more you touch your face, the more likely you are to give it to yourself. The more you wash your hands, the more you remove that risk. So it's all mitigated risk. So when you go out to the grocery store, COVID is not going to jump out from behind the Cheetos and attack you. It's going to be on a surface. It's going to be maybe in someone who's walking on the store. So if you keep a 2-meter distance from people around you, if you wash your hands after you've used your grocery cart, all of those things reduce your risk. So we need to be aware and we need to be conscious of what we're doing, but we don't need to be panicked because we have the information, we have science to help guide us so that we can change our behaviors to reduce the risk of this disease. So very specifically then, if you are in self-isolation, so let's say you've just come back from Florida and you've been told to self-isolate for 14 days, what does that mean? It means that you should be staying at home. You should not be going out and about. You should actually be seeing if somebody can get your groceries for you and bringing them into the house, because now you are not sharing your lottery tickets with the world. Similarly, you're not being exposed to the lottery tickets that are out there. So it's a sort of a safe thing. Does this mean you have to? No. And for people who might be in a very difficult position where they don't have anybody to get groceries for them, I get that. So just take caution when you're out in these public places so that you minimize your time out there, so that if you do have a cough or sneeze, you do it into your arm, into your elbow, or into your shirt like that, so that you're not spreading out little bits all over the place. What do you do if you've got 2 people in the house where one has been, maybe has symptoms and the other doesn't? Again, you should try and keep your spaces as separate as possible. So that might mean having their own bedroom, their own bathroom. When you're sharing a meal together, making sure there's 2 meters distance in between you. And then again, remembering this concept of lottery tickets. So the spaces that you travel in are going to have little lottery tickets dropped all over the place. And if you walk through and these shared spaces and pick those up, you could become infected. So the more you minimize that, the better you're going to do overall. And frequently washing surfaces will really help with that as well. So that was a bit of a long-winded answer. We'll see if anybody's listened to the end. Okay, the next question I've got here. How long does it stay airborne or on surfaces? So it doesn't stay airborne very long because as I'm talking, little bits are coming out, but then they're falling to the ground. If you're a healthcare provider, as I am, we do know that there are certain procedures we do, such as intubating someone, which is putting a tube down their throat to help them breathe, that can aerosolize those particles a little bit more. And that's a completely different scenario, and one in which, yes, it can be airborne long enough that a healthcare provider with a mask might get infected. So we do very special procedures for that. But otherwise, we do not say that this is an airborne disease at this time. So it's not like measles. The other one was how long it can live on surfaces. So it actually appears to live longer on surfaces that are not porous. So what does that mean? So if the virus landed on my shirt here, for example, it dries out quicker and probably only will live for maybe 24 hours at the most. That seems to be the evidence that's out there. But on a surface like metal or plastic like this, it can last much longer, looking more like 2 or 3 days. However, in both circumstances, it can be eradicated by washing with soap and water. You don't need anything more fancy than that. I mean, that does take sometimes a little bit longer. So the other thing you can do is make yourself a bleach solution, 1 part bleach, 99 parts water. You can spray that on surfaces, let it sit for 10 minutes, and then wipe it off, and that will kill the virus as well. Now, on the topic of cleaning, I did get a question about, is cold water temperature okay? Yes, absolutely. Just with soap. So soap, the way that it works, it lathers up in your hands, but it also breaks down sort of coating on the outside of the virus, and so that's what helps kill it. So it's not the temperature of the water, it's washing with the soap that gives it the best benefit. So I think those are all the practical sort of scientific questions. A couple people have some logistical questions. So question about how many positives in Uxbridge, none that we know of so far. However, lots of tests have been sent. And so I do expect that some of those are going to come back positive. Okay, so not to instill panic, of course, but just to be aware, I'm quite confident that there are at least a few cases in our community here. The other question someone posted here was about the wait time. Well, all I can say is I think public health is completely run off their feet. There's one lab that's processing all of these. We'll have to leave it to the people who are above my pay grade to help sort that out. Initially, the wait time or the turnaround was 24 to 48 hours. We're now looking at 4 or 5 days. But the thing to keep in mind is this. You don't need the result of a COVID swab to say whether you need to stay at home or not. If you are feeling sick, if you have come back from travels, if there's any doubt in your mind that you might have any symptoms of COVID, stay at home. That's what you should be doing. Stay at home, binge watch something on Netflix. Do not watch Contagion. I do not recommend that. And just take this time to, maybe work on a project you haven't worked on before. Don't fuss over the results of the swab, because that's not going to change your management. When does COVID swabbing change your management? It's going to be really important for us to know when and if it gets into one of our elderly facilities in town. So that would be Showbrook Gardens, Douglas Crossing, Butternut, the hospital, or Reachview. Those swabs are going to get priority because that changes things. That's a very high risk population. We'd have to institute all sorts of public health measures to try and clamp it down. For the average person, when we tell you have COVID-19, you get to maybe do an update status on Facebook or something, but otherwise you're just going to have a sniffly nose. You'll have maybe a bit worse than the man cold, but the vast majority of people are going to be fine at the end of this. And so it's just a matter of getting over the symptoms, and while you're sick, not spreading your lottery tickets of COVID to the world around you. So I think that's probably long enough for our first one. I'm looking across to my videographer here. And keep the questions coming. Happy to answer them when I can. And stay safe, everyone, and stay isolated.